Coming to cardiovascular changes in exercise. Cardiovascular changes can be divided into changes that which occur in the heart and changes occurs in the peripheral circulatory system. Changes in the heart, these includes increase in the heart rate, cardiac output and coronary blood flow. Whereas peripheral circulatory changes includes changes in the systolic and diastolic blood pressure, blood vessels, and in skeletal muscles and capillary artery venous difference. Benefits of circulatory adjustments. Working muscles and heart are better fed and drained well. The better draining helps them to remove their extra heat. Increased quantity as well as velocity of blood to the tissue helps in better exchange of gases. Increased venous return happens because of increased physical work by muscles. So these are some of the changes that occur during the exercise. The heart rate increases proportional to the severity of the exercise, but in trained athletes the increase is less than that of untrained individuals. In healthy individuals, heart rate will not exceed more than 180 beats per minute. In advanced age, there is a less heart rate rise even with the same weightage of work done. And these changes occurs mainly because there is a fall in the vagal tone and a rise in the sympathetic activity, the adrenaline secreted in the early phase of exercise, and rise in the body temperature and in later phases, which mainly leads to tachycardia. If you see the cardiac output changes, the cardiac output increases tremendously during exercise. The normal untrained persons can increase cardiac output little over fourfold, and the well-trained athlete can increase the output about sixfolds. Increase in the heart rate, mostly with increase in the stroke volume, together cause increase in the cardiac output. That will be according to the Frank-Starling's law. As the heart rate increases, there is a shortening of the diastole, that is less time for the cardiac inflow, but the venous return increases impressively, compensating the decrease in the diastole period. And in untrained person, in moderate exercise, stroke volume rises only mildly, that is around 10 to 30% during severe exercise. In this person, the stroke volume will rise further, but in trained athlete, the stroke volume rises sharply even in moderate exercise, and in severe exercise it may be doubled. Coronary circulation. Coronary circulation increases with the heaviness of exercise. So this occurs because due to the local hypoxia of the myocardium, and sympathetic also has some role in this, as they are more active through the beta receptors, which leads to cardiac coronary dilatation. Systolic blood pressure. Systolic blood pressure usually in moderate isotonic exercise increases, and the systolic blood pressure depends more on cardiac output. As the cardiac output increases, blood pressure increases. Effect of vessels of skeletal muscles. There will be severe vasodilatation of the blood vessels occur during exercise. This may be due to the vasodilator effect of cholinergic sympathetic activity or due to the local metabolites and local hypoxia. The artery venous difference is increased due to the increased oxygen extraction, as there will be raised coefficient of oxygen utilization from resting value of 4 ml per 100 ml to maximum of 16 ml per 100 ml. And this difference is mainly contributed to increase in the 2,3 DPG. According to the Bohr effect, this has to occur.